I'm Lisa Jones, an obstetrician gynecologist and the CEO at Health First. So you've made it through 9 months of pregnancy and you're eagerly anticipating the delivery of your baby. How do you know when it's time to go to the hospital? How do you know if everything's going to be okay? How do you know what pain relief is available to you? These are common questions for all moms. I would start by saying these are all things you should talk about with your provider before you're actually in labor. But if you have any concerns or any thought that you might need to go to the hospital, you can always call your provider at the moment. Generally, we ask moms to call or notify us if they're having contractions every 5 to 10 minutes, lasting more than an hour. We ask moms to call their provider if they think their water broke, or if their baby's not moving the way it did in the past, or if they have bleeding like a period. All of these things are important signs that labor might be starting, so you'll want to make sure to let your provider know. But if you have any concern or any question at all, best to just go to the hospital. Once you're admitted to the hospital, you'll find that they'll draw some blood work. They'll attach your belly to a monitor that will allow you to hear the baby's heartbeat and monitor contractions. You'll probably have an IV to have some fluids. And then the waiting game begins. There are multiple options for pain relief while you're in labor. You might opt for IV pain relief. You might opt for an epidural. You might opt for no pain relief at all. These are all acceptable options. This is not a competition, and whatever pain relief or no pain relief you choose is right for you. When the time comes, your provider and your labor and delivery nurse will coach you through pushing and breathing. It's important to have a support person in the room with you during this time. We ask that there not be hundreds of people in the room with you, but 1 or 2 special people there for this incredible moment is valuable to you and valuable to your baby. You might find that there's a lot of people in the room as you deliver. Depending on the hospital that you deliver at, pediatricians will sometimes join the obstetrician in the exam room. That's normal. That's not something to panic about. After the baby is born, the baby will be taken to a warmer in the room where the pediatric provider or the nurse can check out the baby and make sure they're doing well. During this time, you'll deliver the placenta and receive some medicine, probably called Pitocin, which helps your uterus to squeeze down and not bleed. Then your baby will be brought back to you, and breastfeeding will be encouraged if that's something that you choose to do. Breastfeeding is healthy for newborn infants as it transfers immune system components. It helps the things in your blood that help fight infection, transfers those to the baby so that the baby has an immune system that is active and able to fight off bacteria and viruses. Bonding with your baby right after delivery is an incredible experience, and I would encourage you to take advantage of rooming in, having the baby sleep in the room with you, of frequent contact, of skin-to-skin contact where there's no clothing barrier between you and the baby. All of these things promote bonding and ensure a happy, healthy infant.